Hi, I'm Lisa Crowther, and this is my head-to-toe assessment for Maryville University Advanced Assessment Course Nursing 612. This is our volunteer, Claudine, who has given me permission to do a head-to-toe assessment today. Before we came into the room, we took a complete set of vital signs on Claudine, including height and weight. We tested her vision with the Snellen eye chart, which was 20/20. So that's great. She emptied her bladder, and I've asked her to put on a gown. I've already washed my hands, and we are going to start with inspection and palpation of the head and the scalp. So we're going to start with the scalp, make sure that it is completely intact and there's no masses or abnormal nodes, and that's all normal. We're going to palpate the hair for texture, make sure that there's even distribution, make sure that there's no areas of alopecia. We'll fix it, we don't want messy hair. We're going to palpate her facial bones and note symmetry with the ears and the eyes, the mandibular joint, and make sure that there is no popping sensation there, and I'm not causing her any pain. No pain there?
No pain.
Good. Okay, and now we will then test the cranial nerve 7. So what I'm going to do is ask you to clench your eyes nice and tight. Perfect. Clench your teeth and stick out your tongue. Smile. Puff out your cheeks. Very good. And let's see, one. That's okay. We'll come back to it. We will then palpate her sinuses. So frontal, normal, no swelling, and there's no pain there.
Nope.
Maxillary.
No pain.
Okay, very good. We're going to test light sensation. Can you feel that?
Mm-hmm.
Yep. And that?
Yep.
Feel that on both sides? Okay. Your cheeks?
Yep.
Okay. Here?
Yep.
Good. Chin?
Mm-hmm.
There?
Mm-hmm.
Okay. And you felt that all on both sides?
Yes.
Okay. Okay, so we're going to move to eyes. So we are going to look, and we're going to make sure for symmetry, we're going to look at the eyebrows, make sure for even hair distribution, look at eyelashes, make sure they extend forward, which they do. We are going to look and inspect the lacrimal apparatus, make sure we don't cause any pain there, make sure there's no inflammation, it appears to be fine. We will look at the pupils. So direct, dilatation, consensual, direct, consensual, very good. And then we're going to look at the conjunctivi, pink, moist, scleral looks normal, pink and moist, scleral also looks normal. And we're going to do the cover, uncover test. So what I'm going to do is I'm going to ask Claudine to cover this eye and focus on one spot on the wall, and then I'm going to look at her eye and make sure there's no abnormal movement or nystagmus. And that's great, okay? So now cover the other eye. And that's normal, good. Lastly, for eyes, we will do the 6 cardinal fields of gaze. So I'm just gonna have you look at my finger, okay? Just don't move your head, just move your eyes, very good. And that's all normal. So we're going to move to her ears. We're going to inspect for, again, symmetry. We're going to palpate the auricle and make sure that there is no pain that is elicited once I'm palpating. We are going to test her hearing today, and we're going to do the whisper test. So I'm going to come back over Claudine, and I'm going to whisper a word, and I'm going to ask that she says the word that I whisper.
Orange.
I'm going to come on the other side.
Apple.
Very good. Now we're going to use the tuning fork. I'm going to strike the tuning fork, and this is the Weber test, and we're going to put it on top of her head. And do you hear that in both ears?
Yes.
Great. Okay, we're going to do that on her mastoid. And tell me when you stop hearing it.
It stopped.
Okay. And now.
It stopped.
Good. So that's normal. So Claudine heard it for about half the time when it was touching her mastoid, then when it was lateral to her ear, meaning that she can hear it longer through air conduction versus bone conduction. So now we're going to look at your nose. I'm just going to ask you to tilt your head back. We're going to look inside your nose, make sure there's no deviation of the septum. Make sure that it's pink. And noting that I can see the turbinates, which I can. And that all looks normal. I'm going to ask you to just cover one nostril. And can you take a breath in the other nostril? Good. And switch. Good. So there's no constrictions there. We will move to her mouth. We're going to look. I'm going to look at her lips, the buccal mucosa, the tongue, all sides of the tongue, the lateral, underneath the tongue, making sure for any suspicion, the absence of any kind of suspicious lesions. I'm going to look at her teeth. So you open your mouth. So teeth all appear fine. No chips, no broken teeth. Tongue looks fine. And then if you could put the tongue on top of your mouth, good. Look underneath. We're going to look on both sides of her tongue. Good. Now look at the buccal mucosa. Good. Very nice. Everything looks normal there. And we will look at the bottom, the floor of the mouth, and the soft palate. All right. So now, Claudia, I apologize in advance. I just have to make you gag so we can take a peek at your tonsils, look at your uvula. So we'll look at the anterior and posterior pillars. We'll look at the uvula. We'll look at the tonsils. Okay. Open your mouth. Say ah.
Ah.
Okay. All right. And there's a positive gag. And the tonsils are +1. I'm sorry.
That's okay.
And now we will look and inspect and palpate the neck. So you want to make sure that if you have symmetry, you want to make sure that you don't feel any abnormal fullness. If you want to, you can just look this way. There is no presence of jugular vein distension. So that's normal. I'm going to palpate the trachea and make sure that there isn't any kind of tracheal deviation, which there's not. I'm going to palpate the thyroid, and that feels normal. I'm going to palpate the carotids, but I'll be sure to do those one at a time. We wouldn't want to do both at one time. We can include blood flow to her brain. Okay. Good. And let's just do some range of motion. Let me have you do flexion. So you're going to put your chin to your chest. Very good. Extension. Look up to the ceiling. Good. Shrug your shoulders. Perfect. And if I can have you turn your head towards your shoulder. Excellent. Other side. Good. And that's all normal. So we'll just want to take a listen. listen over the trachea. So we auscultate over the carotids and the thyroid, and I didn't hear any kind of thrill or brewing, so that's normal. And now we're going to palpate the lymph nodes. So we're going to start here, preauricle, postauricle, occipital, submandibular, submental, superficial cervical, deep cervical, infraclavicular, and then under here we have axillary. So per our client's request today, even though we would never auscultate over close, we're going to do that today just for the purpose of the video and per our client's request. So I'm going to palpate the axillary node over her Johnny coat today. Okay, now let's look at your muscle strength. Let's look at your arms and the upper extremities. So we're going to feel the shoulders, noting muscles, noting any protrusions, feel the hands, look at the nails, be sure that there isn't any clubbing to the fingers, noting capillary refill, which is less than 2 seconds, so that's normal. The temperature is warm. Color is normal, so that is all normal. So what I'm going to do now is feel her radial pulse and brachial. Go on the other side here, feel radial. And brachial. All right. So now, Colleen, if I can just look at your back, so I'll just ask that you can turn your legs over this way. Are we able to get her back up? Okay. So what we're going to do is we're going to inspect the skin on the back. And the skin is intact, it's pink, there's no suspicious areas of concern, there's no moles, there's no skin tags, so inspection appears to be normal. She's warm. We are going to do thoracic configuration, which is less than 1 millimeter, so she doesn't have any kind of barrel chest. We will do palpation of the costovertebral angle. So I'm just going to do palpation there. Make sure there isn't any inflammation in the kidneys. And I'm not hurting you at all?
Nope.
Great. Now we're going to check thoracic expansion. So take a nice deep breath in and out. Good. And my hands rose and fall equally. So her thoracic expansion is equal, which is normal. So now we're going to do tactile fremitus. So Colleen, every time I touch your back, I'm just going to ask that you say 99.
Okay.
Okay, go ahead.
99, 99, 99, 99, 99.
Great. And now we're going to palpate. So I should feel resonance, or I should feel resonance. I'm going to do that intraclavically. Okay, so you can just take a deep breath. Yeah. And deep breath in. So I I can feel dullness here. So I would normally make a mark here to note the, you can let your lid out, sorry, diaphragmatic excursion. So I would make a mark here, and then I'll ask her to take more deep breaths in and out. And then I would make a mark here. And it's about, I would say, 4 centimeters, which is normal. Normal diaphragmatic excursion. So we're going to next listen. Okay. Just deep breaths. I'm going to listen laterally. Okay, and you can sit back. So now we're going to look at the anterior chest, and we're going to make sure we're going to assess the recording, make sure there's no heaves, and we are going to also palpate. So noting the breath sounds in the back, posteriorly, there are no adventitious breath sounds. They all sound normal. So we'll want to note the same in the front, and we will also want to make sure that there's no heaves. We'll want to note the applicable impulse. We'll also want to do tactile fremitus. So you can just say 99 again.
99, 99.
Okay, and that's normal. So we'll want to listen. Okay, we're going to listen to her heart sounds. We're going to listen to a normal S1, S2. We're going to make sure there's no murmurs. And we're going to listen over the areas of all the valves. So aortic, pulmonic, Erb's point, tricuspid, mitral, so I hear in S1, S2, I don't hear any S3 or S4 sounds. I don't hear any murmurs. So heart sounds are normal. So we're going to move to the abdomen. So I'm going to just ask, I'm going to actually put your feet up here. Okay. And we are going to inspect the abdomen. And the abdomen is appears to be normal, and we're going to always inspect before we palpate, percuss, or auscultate. So the contour of the abdomen is normal. We are going to now listen. So it's always auscultation first. I think I might have said that in backwards, but always auscultation first in the abdomen. So we're going to listen to the four. So there's four abdominal regions, and we're going to listen. And if we don't hear abdominal, if we don't hear bowel sounds, then we would listen for a full 5 minutes. So I'm going to go midline, and I'm going to listen to the aorta. I don't hear any bruit or thrill there. Listen for renal. Cover up here, moving down to iliac. And femoral. So now we just want to do palpation. Does that hurt anywhere?
Nope.
So over spaces of air, we should feel tympany, and then as we move up to the organ, we should feel dullness. And I can definitely feel the difference. So on our, I'm going to come over to our right, and I'm going to identify the order of the liver. That feels different, that feels more dull, so I would not going to mark her skin, but this is definitely where you'd feel, where you would mark to one border. And then you can feel tympany again. Do the same for the spleen. And then you would palpate the liver, and ideally in a well person, you're not really going to be able to palpate her liver because her liver is not enlarged. So I don't feel her liver underneath.
That's a good thing.
Yes. We'll do deep palpation here, and the spleen doesn't feel enlarged. Okay. So I didn't hear any aortic pulsations. I will ask her now we'll do the pulses in her legs, her feet. So, and then we'll note, she has shaved legs, so we can't notice any any kind of hair distribution that's abnormal that would indicate some kind of peripheral vascular disease. So that looks normal. Now her lower extremities feel warm. They're free from edema, and we'll feel her pulses. DT's here. DPs. Again. Dorsal posterior, dorsal tibial. Okay, let's have you just raise your knees up. Good. Okay. And now push down like you're pushing on gas pedals. Great. And then I'll try to push your feet up. And don't fight against me there. Resistance. Perfect. Excellent. Put your feet back down. And let's do the same thing with your legs. Okay, so you're going to not let me pull your, you're going to try to pull your legs up towards the ceiling. I'm going to push them down, and you can fight against me. There we go. Okay? And pull. There we go. Perfect. Excellent. And now we're going to have you sit up. And I would notice abdominal muscles to make sure that there's that there isn't any kind of contortion with abdominal muscles, and that looks fine. Lastly, we're going to do her reflexes. So we will do brachial, without breaking your watch. Good. Good. Keep doing this. Good. And good. Okay, I'm just going to have you actually stand up. And I'm going to have you squat.
Just.
Yep, perfect. Okay, and now I'm going to look at your back and the thoracic spine, which all the curvature looks normal. And just twist to the side. Twist. The other side. Good. And lean forward. Perfect. And the curvature of the spine is normal. You can get up. Excellent. And the only thing that I want to do left putting is if I can just take a peek into your ears.
Oh, perfect.
I'm going to take the pinna up and back. And I shouldn't be hurting you at all. Is that hurting?
Nope.
Good. And that looks great. So there's no wax, and the tympanic membrane looks clear and gray. So thank you, Claudine, very much. This concludes our examination.